Good morning. I'm Dr. Lena Wen. You may know me as the Health Commissioner of Baltimore City, but I'm also here today in my role as the Chair of Behavioral Health System Baltimore, or Bhsb, which is a non-governmental and quasi-governmental organization here in our city that oversees behavioral health in Baltimore. I wish that I could be here to welcome you in person, but today I have the honor of representing Baltimore at the U.S. Capitol in front of the Senate Health Committee, where I'm testifying about the innovative work that we're doing around behavioral health and specifically about preventing the opioid abuse epidemic here in our city. I look forward to continuing to work with each and every one of you, and I hope that today you'll have the chance to meet with our board, our tremendous and dedicated staff, and also our new leader. Today, I am thrilled to announce that after an extensive national search and interviews with dozens of stakeholders across our city, including faith leaders, government leaders, nonprofit leaders, providers, that we have identified a phenomenal leader for behavioral health system Baltimore, that Kathy Westcoat, who comes to us with extensive experience in public health and also in Baltimore has been the leader for Healthcare Access Maryland, is now our CEO and president, and she is here and will be welcoming you later today as well. All of you know that it's been a challenging year for our city. In the middle of the unrest, we saw the huge needs that there were for physical health when there were dozens of pharmacies that burned down or were closed and people were without access to medications and food, but also that there are ongoing needs, and in particular when it comes to mental health and behavioral health, which we know ties into everything. If our children are experiencing such deep trauma that they can't focus in school, that's going to be impacting our educational system, impacting our employment opportunities, impacting the future of our city. So we have renewed emphasis on screening and treatment for mental health and behavioral health. Also, it's critical that we not only see individuals as perpetrators of violence, but as victims of trauma. Our Mayor Rawlings Blake has declared that Baltimore is going to become a fully trauma-informed care city, which means that the health department together with Bhsb are working on training every frontline city worker on understanding and recognizing the impact of trauma. That means social workers, teachers, police officers are all going to have this change in frame and change in mentality, changing conversation, so that we're approaching behavioral health from a public health and health perspective. This also includes addiction. Nationwide, only 11% of patients who have substance addiction are able to get the help that they need, which is unacceptable as a society and unacceptable as a city. This is a life and death issue. Here in Baltimore, there are more people dying from overdose than there are from homicide. This is why, as part of the Mayor's Heroin Task Force, which was released, the recommendations were released earlier this year, we have come up with one of the most progressive overdose prevention plans here in our city. You'll be hearing more from Adrienne Bridenstine, our new overdose director, about that work, which is what I'm testifying in the U.S. Senate about today as well. But we need your help to help implement not only the things that we can do alone. There are things that we can do alone as the City Health Department and Bhsb and our partners, but there are other things that require further funding so that we can have, for example, treatment on demand, treatment at the time that someone is requesting services, so that we're able to get case management services out to our most vulnerable individuals, including those leaving our jails and prisons, so that we can launch public education campaigns and further our campaigns so that everyone understands that addiction is a disease and treatment is possible, and so that we can further support our stabilization center efforts led by Delegate Hammond that you'll be hearing about later today as well. We need all of your help to increase funding here in Baltimore City around our critical needs in behavioral health. Prior to the unrest, this was already a huge and urgent issue that really ties into the fabric of everything else in our city. but this need is even more acute, even more urgent now, coming into this legislative session. And we want to thank you for your hard work and your advocacy on behalf of our citizens here in Baltimore City. I wish to again extend my warm welcome to Kathy Westcoat, who I am sure has the full confidence of not only our board, but also the entire community to move forward on these critical needs. Thank our dedicated staff here at Bhsb. I have been impressed every day in working with our staff just how much people care and how much we're doing to really serve the needs of our community. And on behalf of the Health Department and Bhsb, I wish to extend again my thank you to you, to say thanks for all your work and to hope that you can call on us anytime, because we stand here ready to serve with you to move together on our critical priorities in behavioral health here in the city. Thank you.